It's your favorite doctor here, Dr. Byron Jackson, known to most of you as the Good Doctor. Today I want to share with you something I share with my patients, which is how to manage wrist pain. You have to understand one of the most common diagnoses in our country, what I see a lot of in practice, is people with wrist pain or carpal tunnel. You know, a lot of times I tell patients that, it's not necessarily your flexion or your gripping muscles that are weak. Sometimes it's your extensor muscles. What you have to understand is that every day you use this type of motion. Every time you grab a fork to eat, every time you turn your key ignition, every time you turn a doorknob, every time you write with a pen or a pencil, you're using this type of motion, but very rarely do we strengthen our extensor muscles. And sometimes that can cause some aches and some pains in the wrist. So I tell people to take a common rubber band. You want to wrap that rubber band, I tell them, right around the tips of their fingers, and then you want to extend outward. You want to extend the fingers. Try not to have the fingers bent, but you want to extend them. I have people do this 10 times, 3 times a day. So that's 30 throughout the day. Maybe in the morning 10, in the afternoon 10, and in the evening 10. This has helped some of my patients manage some of their wrist pain, and I just wanted to share it with you. This is Dr. Byron Jackson, known as the Good Doctor. I just want to always encourage you to strive for excellence and to become as healthy as you possibly can. Because remember, you breathe the same air as every healthy and successful person. And if we did it, you can too.